Okay, what is the most appropriate next step in management? This is a 55-year-old. Oh, wait. I am haloperidol, lorazepam, risperidone, thiamine, or antibiotics. So 55-year-old woman, she has a history of alcohol use disorder. She's admitted to the hospital for pneumonia. She's been receiving IV antibiotics and fluid for the past 3 days. On the fourth day of admission, she becomes agitated, disoriented, and experiences auditory hallucinations. Her vital signs are as follows: temperature 37.5. She's very tachycardic, respiratory rate 20, and blood pressure of 140 over 90. Most appropriate next step in management. Um, well, it seems like she's having alcohol withdrawal,
Okay.
but I'm like, maybe I'm getting like too nitpicky about it, but I'm like, okay, like 48, I guess it's 40, between 48 to 96 hours, you can have alcoholic hallucinations,
Okay,
which
good.
case you would give lorazepam.
Good. Perfect. Talk to me your train of thought of, what was distracting you? What were you thinking until you kind of got back to you? You're like, you know what? Wait a second. So what were you thinking about being too nitpicky on?
Well, I was like, okay, it's been 4 days, and I know that alcohol, like hallucinations, occurs within 2 days. But then I was like, oh, it's between 2 to 4 days. So I was like, okay, 4 days like kind of fits that picture.
Yeah, for sure. So remember that, when we're learning kind of these diagnoses, we get a range of kind of time, like especially like, you're talking about alcohol withdrawal, right? Um, if you had the same picture and it happened 5 days after, would you think it's something else? That's my question. You know what I'm trying to say?
Yeah.
It's this if it's like if they give you all the kind of the history of alcohol abuse, right? You have kind of all the symptoms of delirium tremens, right? And things like that, right? Even if it's 5 or 6 days after, right? You gotta ask yourself, it's probably likely still alcohol withdrawal, right? Because we give these ranges on what is most likely to happen, right, within 2 to 4 days, but it can be earlier, it can be later, it just depends, right? So just kind of keep that in mind. Don't take everything too how do I say this, too rigid, right? When you're talking about like, oh, this is the time frame that has to happen. If it's out of that, then it can't, because think of it more clinically, because this test is going to be more clinical. So don't make it too rigid or else it's going to screw you up.